Okay, thank you for kindly introduction. I want to say that I'm pleasure because I'm here today, and I want to first of all say good afternoon, everyone. So I will talk today about Dysembryoplastic neuroepithelial tumor in an adolescent female. Just as about case report. DNETs are slow-growing benign neoplasms associated with favorable prognosis after complete resection without subsequent radiation or adjuvant chemotherapy. First described in 1988, here Dysembryoplastic neuroepithelial tumor are rare benign brain neoplasms found actually in supratentorial compartment. Most common actually is in the temporal lobe, typically in the children and adolescents, and classically present with intractable partial complex seizures. In 1993, DNETs was given a place in World Health Organization classification of brain tumors such as grade 1 of neuroepithelial origin in pathological. We report the case of a young adolescent female who experienced possible seizure activity and was found DNET proven by biopsy. This is something about the patients. She was a 23-year-old female who experienced insomnia, headache and muscle pain actually 2 months before admission with Glasgow Coma Scale 15 and without neurological deficit. She was admitted to the neurology clinic following a seizure-just-like activity. The patient is recommended to do EEG, findings of the brain indicating an irritative region of the temporal lobe. She was not motivated to be hospitalized, so an MRI of brain under the supervision of neurologist is recommended. On MRI scans, we show frontobasal left zone of hypersignal on T2 and the flare sequence, and hyposignal visualized on T1 without diffusion restriction and the significant post-contrast opacification. This is the measures 25 of anterior-posterior diameter, 23 is bilateral diameter, and 22 is about craniocaudal diameter. Described zone is mostly correspond by low-grade tumor, less likely to other. After 2 years, the patient decides to do surgery and underwent a supraorbital craniotomy. The tumor mass is in the region of the rectus gyrus and olfactory trigone. Pathological examination demonstrates the presence of the round uniform cells in a myxoid background with diffusion reactivity of glial fibrillary acid protein and OLIG2. Methylation and NGS sequencing were done, but on the Faculty of Medicine, Ljubljana, and the finding corresponds to the complex subtype of Dysembryoplastic neuroepithelial tumor. This is how that looks on MRI scans, where we can show on the T1 scan, this is one hyposignal zone on the frontobasal left area. On the T2, there is a hypersignal, and on this image we can see the diameters of this this zone. On the on this image, we can see here diffusion restriction. On the flare is also hypersignal in this area, but on the post-contrast scan, we don't see the post-contrast opacification. I just want to show the CT scans also on our patients after surgery. So we we are here see the one hypodense zone, but post-operative etiology, and also we can see the post-operative pneumoencephalus, but is also including the post-operative procedures. This is also CT scans about after 4 months of also previously the CTs, and it's without changings in this scan. But the patient was due the MRI scans also after surgery, so we can here see on the T2 sequence one zone of hypersignal. Actually in the flare we can see that too, but on this scan we don't see the diffusion restriction. On post-contrast scan we see here the zone of post-contrast opacification on dorsolateral line of this frontobasal area, but also post-operative etiology. These neoplasms have been described in approximately 20% of surgical resected tumors in a patient with medically intractable epilepsy. Intractable epilepsy is almost the only symptom of DNETs. DNET has been proven to be the second most common epileptogenic tumor in the children following ganglion cells glioma. The study that includes 29 patients showed a lesion in the right frontal lobe in one patient, just like the same as our report. On neuroimaging, DNETs often show solid and the cystic mass with the cystic portion. But the cystic signal pattern is not always specific to DNETs, but is also found in other tumors associated with epilepsy, such as gangliogliomas and gliomas. The solid components often appear with multinodular hypotense on T1 weighted MRI images, hyperintense on T2 weighted MRI image, and occasionally weakly enhancing in young adults. People, and I just tell about recent case reports who have shown that these lesions may undergo malignant change. In 2000, Haymond and all reported the first malignant transformation of DNET that had been surgically resected. Because DNETs have only been discovered within the last 20 years, their natural history is not yet completely defined. The incidence of rate DNET is extremely low. It needs to future research, so to facilitate a more comprehensive summary. Differential diagnosis, there is much more, but I will show the mostly who can be. That's oligodendroglioma, low-grade astrocytoma, mostly occurs in the children and adolescent, age 20 to 40 years. And it's often located in the white deep matter. Ganglion cells glioma tumor are more common in adolescents. The MRI spectroscopy manifestation of reduced and acetyl-aspartate peak and lack of choline peak can help to distinguish DNTs from other tumors in the brain. This is the image who I put on this slide to show how that looks on these other tumors. Here we have oligodendroglioma, ganglioglioma, astrocytoma, who are in a deep white matter, and also some infections of the brain can be one of the differential diagnoses. In our conclusion, DNETs has the possibility of malignant transformation, but the risk is very small. Early diagnosis and treatment of DNET can improve patients' quality of life and reduce unnecessary radiotherapy and chemotherapy. The MRI imaging manifestation of DNET and clinical exams are important to improve our diagnostic accuracy, and the clinical, radiological and histopathological findings have to be considered together to assess the diagnosis and to difference to other diagnoses of DNETs. So this is the reference who I used, and that's all.